Hello guys, today our topic is mesothelioma part 2. Mesothelioma is a type of cancer that develops from the thin layer of tissues that covers many of the internal organs known as the mesothelioma. The area most commonly affected is the lining of the lungs and chest wall. Less commonly the lining of the abdomen and rarely the sac surrounding the hearts or the sac surrounding the testes may be affected. Signs and symptoms of mesothelioma may include shortness of breath due to fluid around the lung as swollen abdomen, chest, wall pain, cough, feeling tired and weight loss. These symptoms typically come on slowly. More than 80% of mesothelioma cases are caused by exposure to abscess. The greater the exposure, the greater the risk. As of 2013, about 125 million people worldwide have been exposed to abscess as work. High rate of disease occur in people who mine abscess, produce product from abscess, work with the abscess product, live with abscess worker, or work in building containing abscess exposure and the onset of cancer are generally separated by about 40 years. Washing the clothing of someone who worked with abscess also increasing the risk. Other risk factors including genetic and infection with the simian virus 40. The diagnosis may be suspected based on chest X-ray and CT scan findings and is confirmed by either examination fluid produced by the cancer or by a tissue biopsy of the cancer. Prevention focusing on reducing exposure the abscess. Treatment often includes surgery, radiation therapy, and chemotherapy. A procedure known as fluoridesis, which involves using substances such as talc to scald together the pleura, may be used to prevent more fluid from building up around the lungs. Chemotherapy often includes the medication, cisplatin, and pemetrexed. The percentage of people that survive 5 years following diagnosis is on average 8% in the United States. In 2015, above 60,800 people had mesothelioma and 32,000 died from the disease. Rates of mesothelioma vary in different areas of the world. Rates are higher in Australia, the United Kingdom, and lower in Japan. It occurs in about 3,000 people per year in the United States. It occurs more often in males than females. Rates of disease have increased since in 1950s. Diagnosis typically occurs after the age of 65 and most deaths occur around 70 years old. The disease was rare before the commercial use of abscess. Sign and symptoms. Lungs. Symptoms of sign of mesothelioma may not appear until 20 to 50 years or more after exposure to abscess. Shortness of breath, cough and pain in the chest due to an accumulation of fluid in the pleural space. Pleural effusions are often symptoms of pleural mesothelioma.